Well, breast enlargement or breast augmentation is a procedure, clearly, which is designed to increase the size of a woman's breasts. The important aspects there is preoperatively in the counselling is to make sure that the patients are aware that there are certain limitations that can be achieved with breast augmentations, such that I personally would not enlarge anyone's breasts beyond, say, an E or an F cup, because I think that's unrealistic, expecting the tissues to stretch to that huge level. Women who do want to go to that size may have to have their breasts enlarged in 2 stages, so a gentle stage of expansion and thereafter the definitive implant. But in general, most patients, I think, are what I would consider sensible and would be increasing from either an A or B cup to the UK average, which is a C, to a D. And I think that is, I always tell patients that I'd like to enlarge them to a size that is in proportion to the rest of their body. And 99% of my patients are happy with that. The preparation for any surgery is really the same. I think all patients should be instructed that obviously they should be as healthy as possible. If they are on medication, to make sure that their medication is taken up until the day of surgery, make sure they're stabilized. One of the most important aspects too is to make sure that their weight is below the BMI of around about 30, BMI being the ratio of height to weight. And in other words, that they're within a normal weight range. That makes both the outcome after surgery and also the type of surgery much easier to carry out. Additionally, we would ask patients to stop smoking, and this is vital for operations such as abdominoplasty, because it's undoubtedly the fact that if people are smoking actively whilst they're having surgery where tissue is stretched, it does affect the healing process, and that's proven without any doubt. We would also ask patients to be very careful about what medication they're taking, whether it be prescription medication and certain drugs such as aspirin, for example, which makes you bleed. People may be just taking a nominal dose of aspirin, but be enough to cause problems during surgery. Certain other homeopathic medications would ask them also to at least alert the surgeon. Things like vitamin E, ginkgo biloba, are all medications which tend to thin out the blood. And even garlic the night before. I'd ask patients to try and avoid that, because that can lead to bleeding episodes during surgery. The operation of breast augmentation is something which I give patients 4 or 5 choices. The first choice I give them is I ask them which incision they prefer. My preferential incision would be what they call a submammary incision, which is a small 5 centimeter incision underneath the breast fold. There are alternative incisions such as in the armpit and around the nipple areola, but these are associated with the more visible scarring in many cases and interference with function. I also tell patients they have a choice over whether the implant needs to be put deep to the muscle or above the muscle of the chest wall, and this has relevance in certain cases. It may not be suitable in every single patient, but at least you can have the discussion as to which is the most relevant. The third is the type of implant that is chosen. One can choose a round implant or what they call a teardrop or anatomical implant. In my opinion, if a patient has a reasonable amount of breast tissue beforehand, you want to push forward that breast in its normal shape forward, and I would choose a round implant for that. If a patient's got very little breast tissue, I would then suggest that if you were to put a round implant in, you would have a very obvious round shape, in which case, in those patients, I would choose an anatomical implant. And of course, the last choice they can make is a size. And the size, we choose from 1 or 3 or 4 companies that are now well known, and they all produce cohesive gel silicone implants, which are the type that you can cut through and they would not leak to the extent that they used to, say, 10, 15 years ago. Following surgery for breast augmentation, most patients should expect a degree of discomfort. But this would be reduced by the use of local anesthetics, which we put both in the wound and deep to the cavity through the drains. The first thing patients notice will be often a degree of surprise and shock at the size they've reached. But in my experience, I would say 98 to 99% of the patients are delighted within a day or two of the augmentation, once they get used to the new size. There is a degree of numbness of the nipple, which can persist for up to 2 to 3 weeks. And in some people, the nipple sensitivity is elevated, so it's a little bit more irritable. Again, this almost always goes back to normal within 3 months. There are a number of risks associated with breast enlargement, broken down really into the early phase and the late phase. The early phase would be the common risks associated with any surgery, such as infection, bleeding, wound-related problems. The wound may open up, the implant may show, and in some cases the implant may need to be taken out and put back in again. This is very rare, but it is often associated with people who've got existing medical conditions where the healing ability is not good. The longer-term risks and complications clearly relate to asymmetry, where one breast looks slightly different to the other one. There is I mentioned before, the potential for capsule contracture, which is really the biggest potential problem with all breast augmentation. And this is where the breasts become firmer and harder, either just noticed by the patient alone or actually visualized by an external observer. And if that happens, it's a simple technique really, just to remove the implant, release the capsule, which is the scar tissue around the implant, and replace the implant.